closing remarks.
And I know the hour is late. Actually, it was a perfect timing, right? Exactly when things should happen. I'm Tim Brigham, the Chief of Staff and Chief of Education at the ACGME, and the co-chair of this conference. But as you can see, this conference reflects what a lot of people have said, that the interprofessional team that we have put together is core to putting this kind of a conference together. And I thank all of the speakers today for a highly informative, sometimes very sobering, but always inspirational conversation and dialogue and presentations. I thank you deeply. Micheline, could you bring up the slide that we talked about earlier, the conceptual model? I'd like to end where we began this morning with Dr. Victor Zhao's talk and looking at the conceptual model. One of the first questions that came up was in the question and answer place was, why is the patient in the middle and not the clinician? And I can tell you that when we formed this conceptual model, there was a debate as to what and who should be in the middle. And it came out as a universal acclamation from all of the people, and there were lots, 50 or 60 people, that the reason that we exist in healthcare is sort of the well-being of the patient. And the deepest source of meaning for all clinicians is the patient. And so we put the patient in the middle. So I'm going to step back a second and just start there. You know, all of us are writing a story with our lives, writing a novel. And in my story, like your story, I am the hero in mine. Steve is the hero in his. Pascal is the hero in hers, et cetera, et cetera, et cetera. And we rarely turn that pen over to write anything in our novel until something hits us really, really deeply. And most frequently, when we turn the pen of our own novel, the life of our own life story, we turn that pen over to a team of clinicians, physicians, nurses, pharmacists, social workers, respiratory, occupational, physical therapists, etc. So why? Why do we do that then? Well, the ancient Celts had a concept of a thin place. A thin place is where the distance between what they thought the eternal world was up here was when the eternal world and the world that we're living in right now narrows, and narrows really, really to a thin place. And those thin places can be amazingly beautiful and shockingly scary all at the same time. They're mesmerizing places that inspire and stir us, but also can disorient us and confuse us. Some places that you can say are thin places would be mosques and cathedrals and temples, mountain vistas, being in the arms of a loved one. But most frequently, those thin places are encountered by people in our halls of healing, in hospitals, in clinics, in spoken words between patients and clinician, where the magic of birth, life, care, and cure happen, and also where people come face to face, eyeball to eyeball, with disease, despair, and death. I saw a quote the other day that said that death is the only God that comes every time we call. And this is where our clinicians reside. Today, in October 2020, when we're in the 6th, 7th, 8th month of the pandemic, the crush of the thin place on top is heavier than ever before. Our clinicians find themselves not only in a thin place, but they find themselves in a thin time. Whereas we've heard the pandemic rages. Racial reckoning is coming to our society. Uncertainty abounds. Economic issues are right at our doorstep. And clinicians are asking questions and making statements in sometimes but a whisper, sometimes just to themselves, as they strive to complete their sacred mission to patients and society, saying, I don't know if I know what to do. I'm overwhelmed. What if I get sick? Will I be safe? Will my family and loved ones be safe? I don't know if I can do this anymore. Will anyone protect me? Does anybody care? The thin place needs fixing. The thin place needs redesigning so that clinicians can do the work that they have devoted their lives to and take that pen from the trembling hand of a patient and begin to write the next word, the next sentence, the next paragraph, the next chapter, to take that person through their life. Our story continues with that. We heard a really, really, really provocative and great presentation by my colleague, Dr. Carrion, about what it means to have redesign a system, to ground ourselves in our values and the importance of values, to have leadership committed to putting those values into action, and to redesign our work around meaning, control, and balance, and teamwork, and resources, and participation. We have heard a lot about some descriptions and metaphors for where we are now in well-being. But one of the most provocative came from our nursing colleagues. It says we're now in an era of moral distress, which was quite well put by the quote we heard earlier, that burnout is something it's something that prevents me from doing my job. So we heard a great and inspiring presentations from Christiana Care and Emery that told us about the importance of leadership, the importance of 3 C's: collaboration, communication, and connection. And the importance, which I've rarely heard this in any kind of a healthcare environment, and the importance of the 4 most underused 4-letter word in medicine: love, 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 and excellence. So when the clinicians call out, hear me, protect me, prepare me, support me, care for me, honor me, we can respond to that. We also heard sobering news about the impact of COVID on the physical and mental health of clinicians. Sobering news on the economic realities that are facing our hospitals and our clinics and our clinicians, and the horrors of structural racism that just come through. And what I'm reminded there is of the story of Pandora's box, that most people don't know the end of that story. The myth of Pandora is that Zeus gives Pandora a jar, actually. She opens the jar and all the ills of humanity come spilling out: disease, despair, war, racism, sexism, death, dying. And she lies down in just complete agony that she has unleashed all of this onto the world. But if you follow the myth to the end, all of those spirits that came out were not the final thing that happened. There was one spirit left in Pandora's box, and that spirit came out, and that was the spirit of hope. So the last panel left us with the sobering news and the sobering realities that we live, that are all if you look at the factors affecting clinician well-being that reside on the outside and sometimes on the inside of those circles. But they left us with hope. Hope that we in our redesigning and our fixing the well-being of our physicians and our nurses and our other clinicians, that we can have a better tomorrow for patients. We can have a better tomorrow for patients. And the hope not only was echoed individually by all of the panelists and all of the people that we had today, the hope started with the initial presentation by Dr. Zhao, who's one of what I call the 3 wise men who started this against all odds, who started a movement that is now engulfing the world in some ways. And that hope is now amplified and exaggerated and bigger than it ever was before, that something can be done, that this train is on an underailable track. So I want to leave you with that, and I want to also leave you with what is coming up tomorrow. This is not the end. Tomorrow we'll be focusing on operationalizing some of the things that Dr. Carrion and others have been talking about. How can you, in your situation, in your institution, in your specialty, in your role, whatever it is, how can you begin to implement effective systems approaches to clinician well-being within your own institutions. And that as came out, something that came out more and more and more as the day went on, we can only do this together. That it takes leadership, it takes engagement of everybody to do this. And with that, I will leave you. Thank you again to all of the presenters and panelists. If we had a reaction button, I'd ask you all to applaud them. But I think I will turn it over. I see Dr. Zhao has come on, so I'm going to turn it over to Dr. Zhao to make the absolute final statement of the day.
Well, that was a surprise. I just came on to listen to all of you. And Tim, what an inspiring end. I couldn't do better. So maybe I shouldn't try, except to say that it's been a really great day, exactly the way you described it. And I would quote you to say, this train is on a underailable track. And let's all get together tomorrow and continue this journey. Thank you.